Greetings, greetings, dear chums. I'm so sorry I've been so quiet lately. I think the last time I made one of these, I was in the COVID nightmare, and it's taken a little while to get back to normal. Still got a cold. It just seems to be hanging around, and I just can't get rid of it. Which is a bit of a bore. Cough's gone pretty much, but I'm still very bunged up around the old schnoz a bit. But anyway, marked improvement on where I was last time you saw me, so I'm very grateful for that. It did sort of set me back a wee bit, not just physically, but sort of mentally as well. I was thinking, oh God, what else do I need? So feeling a bit low and a bit sorry for myself. So took myself off to Maggie's for a Look Good, Feel Better session, which just did me the world of good. And I got some nice, just restoring facial sort of skincare, which was lovely. The more of my eyelashes that are disappearing, the more my eyes are just watering all the time. And I'm finding that, my skin is getting quite dehydrated, just with the constant wiping and pulling, because you just can't seem to, going outside, you've got to have a wad of tissues or hankies, or you're just, in a mess. So that was really nice. That was very, very welcome. But I'm just trying to get myself better for Monday, because I go in for my surgery on Monday. Very exciting. So they're going to whip out the tumour, what's left of it. The chemotherapy has done its job and shrunken it, which is very gratifying. And I'll also have a couple of lymph nodes removed from my underarm as well. Just typical that I'm right-handed, because it's going to render me for a couple of weeks anyway, not able to do much heavy duty stuff with my right hand side. So in preparation for the surgery, I've had all my pre-assessment, my ECG. I had to have all my bloods redone because COVID had left my infection levels a little bit skewiff. But obviously they're all back to normal, because they're good to go ahead with surgery. And last Thursday, I went in for an appointment. I wasn't quite sure what it was. And when I found out what it was, it's probably just as well I didn't find out what it was until I was actually in the waiting room, because I probably wouldn't have gone in had I known what was in store. So what they do, they plant a tiny little magnetic seed into the tumour, so that the surgeon can pinpoint exactly where it is, making removal all the more simple, I'm guessing. So local anaesthetic in the old boobie, buttock clenchingly twinge making, and then they put in this little thing. It's like, she said, it's the size of an uncooked grain of rice, and they just embed it in the tumour. Fascinating, really. She said it's all right, you can still use your microwave, you can still use your remote control, you're not going to set off any alarms going in and out of shops or through airport scanners. Chances would be a fine thing. And then when they do the surgery, they just whip it out again. So I've had a plastered boobie for the last 7 days, which I was able to take off this morning, thank God, because it was starting to itch up a storm. So all I need to do now is just keep myself safe until Monday. They don't even keep you in overnight anymore. You're just in and out, and resting at home. So there we are. So phase 2 of this whole sorry story about to commence. The other thing they will do is send a sample off to a lab just to see what the cancer cell levels are like in my system. If they're above where they would like them to be, they will do more chemotherapy. But I think chances are, well, I'm hoping that won't be the case, and I'll just carry on with my 3 weekly injections of Phesgo, which is immunotherapy, so just boosting my immune system, and sort of just some maintenance drugs just to keep everything at bay, I suppose, and ticking over. I've had so much information and weird names of medicines and drugs thrown at me over the last 4 months. I hope I've got that right. So I've got another 11 injections. I get them every 3 weeks, but you're literally just in and out. They just inject. I mean, the injection takes about 5 minutes to go in. They can't just shove it in because there's quite a lot of it. And if they were to force it through, it really does nip, because it goes into your thigh, just under the skin. So that can be a little bit twingy as well. But I'm sort of getting used to all the needles and things now. But so yeah, I'm just keeping myself busy. I'm back more at, working from home. I do what I can. I've only done one full day. I was so tired after it. It took me about 2 days to recover. So I'm just trying to do maybe sort of 5 or 6 hours a day, the days that allow me, because, oh my God, sleep. I've never, it's like I haven't slept properly for the last 5 months. And now it's all I want to do is sleep. So come 9 o'clock, I'm catching flies on the sofa, mouth wide open and drooling probably. And in the morning, getting up, you just have to sort of drag yourself up. So, I think probably that wretched COVID virus took it out of me a bit. But it's looking positive, and the fact that I can do some more work now is good, because that just keeps the mind occupied throughout the day as well. I'm hoping to get back to work ASAP on site, but obviously I'll just need to see what the consultant says, and once I'm allowed, we can tootle on back. So that's where we are at the moment. Can't believe we're in the middle of November. So better get some shopping done and some cakes made and all the usual pre-Christmas stuff done. So that's it from me, really. So an improving picture and surgery on Monday. And I'll keep checking in with Maggie's centre. And there was another thing I was looking at that kind of prepares you for, what happens afterwards, because I think a lot of people that have gone through this, from the time that you're diagnosed, it's just a whirlwind of appointments and treatments, and you haven't really got time, to come to terms with what's been going on. And then all of a sudden, everything stops, and you're kind of left spinning a little bit. And, there's that anxiety about getting back to normal. It's that whole phrase. It's like, well, what does that mean? And what's that going to feel like? And, I am a little bit anxious, if I'm being totally honest, about, you've had all this support and you've been sort of cocooned for the last 5 or 6 months, and then all of a sudden you're just left to get on with everything again. So I want to make sure that I'm prepared for that when that comes. Anyway, enough of that doom and gloom. So I'll keep you posted. I'll let you know how surgery has gone once that all goes smoothly, touch wood. On Monday, hopefully there'll be no hiccups, no more infections, please. And I will give you an update early into next week. And I promise I'll try and keep in touch a bit better. But I've been feeling a bit crappy recently, so you wouldn't want to see that miserable face all over the place. Anyway, dearest chums, hope you're all well, and thanks for listening again. And I'll see you very soon. Bye for now.